Hello everyone. I would like to discuss a simple technique of body strapping or taping in undisplaced finger or toe fractures. What is body taping or strapping? It is nothing but stabilizing the injured finger or a toe with adjacent normal or uninjured finger in cases of simple undisplaced fractures or a soft tissue injury. It helps to keep the finger in resting position and avoids displacement of the fracture. It also helps to reduce stiffness as some movement is allowed in injured finger or toe. The most common indications for body taping or strapping is undisplaced or minimally displaced fractures with no rotational malalignment, especially in children as shown in this X-ray, as well as in adults where the fractures are undisplaced. How should we not do it? Never use Dynaplast or adhesive sticking to stabilize the finger as shown in this picture. It can be dangerous if applied too tight or if applied in a wrong position. The joint can have stiffness and the circulation of the digit can be jeopardized. If you apply adhesive sticking, the fingers will have very less chance to be mobile and edema can increase and jeopardize the vascularity of the finger. So never ever apply or use adhesive sticking if you want to do body taping. Then how should we do it? The most ideal way to do it is to keep a gauze piece or a cotton in between the injured and adjacent uninjured finger and toe. Then we recommend to use 1-inch micropore tape. The advantage of this tape is it is non-adhesive sticking and removal is very easy. If you wet this tape, because it's a cotton tape, it just becomes loose. Or if you just pour spirit or sterilium, it will come out very easily. Then once you do that, second round of tapping is done in not too tight and not too loose fashion. The nail and pulp of the finger must be very clearly visible to check the blood circulation. Movement in all finger or toes is allowed within tolerable pain limits, and we should ask the patient whether the tapping is having giving comfortable position of the hand to the patient. Another trick I would like to explain to give a body tapping, especially in an adjacent digit, like if there is a fracture in the index finger or a little finger. Now, to describe this trick, if you see the picture on the left, usually the little fingertip is at the distal interphalangeal joint level of the ring finger. If you partially flex or minimally flex the ring finger, then both the digits will have somehow equal length. And if you apply the strap in this position, then if you apply the strap in this position, then the movement of both the digits is very easy to do for the patient and the stiffness can be prevented. So this is another trick whenever you are, treating a undisplaced fracture of ring or little finger. So partially flex the ring finger so that the length of both the digits is somewhat equal and the movement becomes easy. If this strapping or taping gets wet, it has to be changed. While changing, ideally the tape should be carefully cut with the scissor. Clean the web space with water or spirit and let it become dry, and then apply the new tape. Red flag signs: if the color of the fingertip is not pink and if it becomes brown or feeling is cold, then one must consult doctor immediately. Thank you for watching this video. Thank you once again.